watching TVC News at 7. Today is World Malaria Day, and it's a worldwide effort to raise awareness and increase funding for the treatment and prevention of the disease.
Well, in the area of prevention, the World Health Organization says Nigeria will be one of the countries that would benefit from the new malaria vaccine, which is already being tried in Malawi and Ghana. Kemi Balogun has more.
The World Health Organization is using this day to put the issue of prevention of malaria at the forefront of global advocacies. This is with the aim of significantly reducing the massive yearly global death toll of 400,000 people by the year 2020. In Nigeria, malaria remains a key public health problem, with 60% of the burden reported at healthcare facilities. According to UNICEF, Nigeria accounts for the highest malaria burden, responsible for 30% of estimated deaths in children and 11% among pregnant women.
If we need to control malaria, let's reach to everyone, to the communities. And a lot can be done in terms of the community. One important thing is the message. That is very important for the communities to prevent themselves. What do I do to make sure I don't get bitten by mosquitoes? This is very important. The second thing the communities need to know, we need to present them facts in terms of people who are affected, women, children dying from malaria. This will help them to have informed decision in terms of behavior change, but also accessing services.
The World Health Organization says new trials of the malaria vaccine will also help Nigeria a great deal. Trials of the RTSS vaccine has begun in children in Malawi, while Kenya and Ghana will follow soon. The goal is to vaccinate about 360,000 children in a large-scale pilot project.
It's a very important tool that will also help to control the vaccines, but we cannot scale it at once in all the countries. You know, these are vaccines, as they get used, they're also evaluated, and they make sure that definitely this is important. Nigeria is a very important country, among the high burden country. This has not been thrown out of. It is an option that definitely be considered. But as of now, let's look at the strategy that exists. The government has already deployed. Let's do more, scale up on the response, and then things will be better.
In an earlier trial, the vaccine reduced the number of clinical malaria cases by about 40% and severe malaria cases by 30%. Kemi Balogun, TVC News, Abuja.